So welcome everyone to today's webinar. My name is Leila Moomin and I am the Community Engagement Coordinator for the Canadian Cancer Survivor Network. Thanks for joining us for today's webinar, Let's Talk Lymphedema. We are pleased to welcome the Lymphedema Association of Ontario to present on this important topic. We are joined by Dolores Steinwall, the President of the Lymphedema Association of Ontario, and Anne Demena, their Director. Our presenters are going to be talking about some of the work that the LAO does, as well as provide some information about the causes and symptoms of lymphedema and inform lymphedema patients on how to access help and support. They will also discuss things from the physiotherapist perspective and discuss what treatments are available. Our presenters, just to introduce them, so Dolores had a long and successful career with Bell Canada and was a senior project manager at the time of her retirement. In August 2014, she was diagnosed with stage 3 cancer in her breast and lymph nodes. Although she is now cancer-free, she has lymphedema in her right arm and side. She is very passionate about helping others with this condition. Since 2015, she has been a volunteer on the Sunnybrook Patient Family Advisory Council, and in 2016, she began to volunteer at Wellspring. While doing this work, she has raised awareness and advocated on behalf of patients. She joined the LAO as the director in April 2019 and was appointed the president in 2019 August. Anne is currently the clinic director and owner of Markham Lymphatic Center, a multidisciplinary clinic located in Markham. She brings expertise from a wide variety of therapy settings, including hospital, home care, and private practice orthopedic settings. Anne is a graduate of the University of Waterloo, where she received a degree in biochemistry, as well as the University of Toronto, where she received a degree in physiotherapy. Anne has continued to add to her clinical expertise with postgraduate training in orthopedic manual therapy, Mackenzie back care techniques, and many other courses. In 2008, Anne completed postgraduate training in combined decongestive therapy and is fully certified to treat patients with lymphedema. She has developed and taught postgraduate continuing education courses, including a head and neck training course. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization that works with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at survivornet.ca. At the end of the presentation, our speakers will be able to answer your questions. However, at any time during the webinar, please feel free to type your questions into the window at the bottom right of your screen. This webinar is being recorded and it will be available on YouTube. I will now turn things over to our presenters. Welcome.
Thank you.
Thank you, Leila. Can you hear me okay, everyone?
Yes, we can hear you.
Oh, thank you. Okay, so as Leila said, my name is Dolores Steinwall and I'm the president of the Lymphedema Association of Ontario. We are very grateful to the Canadian Cancer Survivor Network for giving us this opportunity to talk about what we do in Ontario for our members. And it is doubly important because March 6th is World Lymphedema Day, and we have some other events planned during the month of March as well. So welcome everybody, and thank you for giving me your time. I'd like to share with you the mission and history of the Lymphedema Association of Ontario. We're committed to improving the lives of people living with lymphedema. We are a not-for-profit charity incorporated in Ontario in 1997 and to help the community of lymphedema sufferers in the province. Later on in the presentation, I'll talk with you about the numbers of lymphedema that we have. The objective for today is to share information about the LAO, share information on how to access help and support, share the prevalence of lymphedema for Canadians across the country and Ontario. We have some stats and data we'd like to share with you. And we wanted to also share information on how you can help support the LAO in our advocacy efforts. And of course, as Leila said, there is an overview from Anne Demena, one of our directors. She's a healthcare professional and she'll talk to you in depth about lymphedema. What the LAO offers. We offer a directory of qualified lymphedema therapists in Ontario. We also offer a helpline for anyone with lymphedema concerns to call and speak with us. And we also provide an information line and resources for patients and their loved ones. So you can call us and have someone call you back and speak with you about your concerns, or we can email you back. And you can also check our website that lists our therapists, the qualified therapists, so that you can easily find someone who can help you to work on your lymphedema concerns. The benefits of joining the LAO, we have changed quite a bit in the last 2 years. And along with that, some of the changes that we have made, we have now produced a new professional directory and resource guide for 2021, which will be going out to our members and our community partners in March of this year. We also have been offering webinars for patients and professionals, both to educate and raise awareness and help our patients as well as our professionals. We've been doing that since February 2020. We are launching a new virtual support group on Saturday, March the 6th. We had spent some time planning this out, and we're piloting it on Saturday. We also have been doing interactive fundraiser events. We provide you with the Pathways magazine. We provide you with a quarterly e-newsletter from the LAO, the information line, as I spoke about before, on lymphedema. And we also have a brochure that you can receive from us. And we also have a patient card that identifies the 6 things that you need to know about lymphedema in a very clear format that you could take to your doctor or your health professional. And basically, the cost for a patient to join us is $30. So to talk about a little bit about the stats of lymphedema in Canada and Ontario, this card and this information was originally put together by the Canadian Lymphedema Framework, which is a national organization. What the LAO had done basically was looked at the numbers that they gave us across Canada, and we then came up with the number for Ontario. And this is actually a very big number. These stats are based on older numbers, some of it going back to 2015 and 2016. In the US, there's up to 10 million lymphedema sufferers. In Canada, there's 1 million across the country. And if that is extrapolated out, you'll see that Ontario has a total of almost 400,000 people with lymphedema. This is not something that's widely known, and it is why I wanted to bring this to you and share this to you today. We also have provided you with a breakdown of the reasons why. And as you can see, that the cancer-related lymphedema is 31%, and it is probably by now in 2021 much higher than that. Cancer-related lymphedema is not a widely understood thing, or even, as from my own experience being a breast cancer patient, it was nothing that it was not on the top of my mind when I started out, and I didn't realize that I could end up with lymphedema when my lymph nodes were removed after my breast cancer surgery. So it's something to be really very careful about and be aware about before you go into surgery, because the after effects of cancer, there are a number of after effects, and this is something that most of us have to deal with after we're cancer free, but there are side effects and issues that come up after. The number on that, as you can see, basically is 120,000 people and I'm sure that number is higher right now. And I just outlined some of the other numbers as well. A point to draw your attention to is that lymphedema occurs as a primary lymphedema as well. That basically means that a number of people are born with that, then it's not always recognized or diagnosed until later in life. So there are two main reasons why you may end up with lymphedema. There's also other reasons, trauma and a number of other things, and Anne will talk more in detail about that. I put the numbers up here again, you know, cancer-related 31%, primary lymphedema, surgeries, non-cancer, 15,000 at 4%, disabilities chair-bound 8% for 31,000. These are Ontario numbers, and obesity-related 57%. I wanted then to share with you also some information on our info line. So for the last 2 or 3 years, we've been tabulating the data, and these are the people that are calling us for information. So patients, 75% of patients have been calling us. This was a 2018 demographic, or a number from 2018. In order to try to explain why they're calling, basically, is mostly inquiries about what to do, where to go to find help, and this is sort of the types of things that they're asking us about. They wanted medical advice, they wanted professionals, they wanted to locate people who can help them, financial assistance, and garments. Again, this is the 2018 number. In 2019, the number went up a little bit more. We had more people calling us, 78% patients, 12% professionals, and approximately 10% family and friends. And again, why they're calling? For same type of questions, same type of reasons. So that's the information I have currently on our stats. So with that, I believe I will hand it off to Anne. I wanted to just ask you that we are trying to step up our efforts to advocate on behalf of lymphedema. We have been collecting stats for the last 2 years, and I would ask that please, if you could help us to help you by becoming a volunteer, become a member, by donating some funding to us or some dollars to us so we can continue this work. Our aim is to make a case to the ministry to provide some dollars for treatment. Currently, the Ministry of Health provides us with garments, but no treatment. And given that treatment needs to come before the actual garments, that is a very important part that's missing from our healthcare. So please help us if you can. And our number is here, our address is there. You can go to our website. There's a number of ways you can engage with us. Thank you. And with that, I will hand it off to Anne.
So we're going to talk about the lymphatic system and its organization. So there are about 150 to 200 lymph nodes in through the neck. Then there are lymph nodes that are in your underarm, between 40 and 60. And then there are lymph nodes that are all around the tissues of the deep abdomen. And then there are lymphatic vessels that are now connected to those lymph nodes. And you'll see the next slide talks about the components. So the lymph nodes connected to the lymphatic vessels, and then there's lymphatic fluid. And the lymphatic fluid is fluid that would have leaked out of the blood vascular system into the spaces all around the cells around your tissues. That fluid is lymphatic fluid that needs to be picked up by the lymphatic vessels. So it's very high in protein and water, and that's what is picked up, and that's called lymph. And then you have your lymphoid tissues, which would be the thymus and the spleen. And the lymph fluid, again, it's made up mostly of protein and water, not proteins from your diet, but proteins that would have leaked out of your blood vascular system to nourish the cells. The functions of the lymphatic system. So the function of the lymphatic system is to clear debris and toxins from around the cells, circulation of cells that fight bacteria and viruses and also detect cancer cells, remove waste materials and proteins from around the cells. And its job really also is to prevent you from swelling so that you don't develop lymphedema or any form of edema for that fact. And then it really does maintain your body's inner balance. And so this is what the lymphatic system would look like at the layer of skin. So around 70% of the lymphatic vessels sit between the layers of skin, so they're very close to the surface, and this is why manual treatment works so effectively. The green vessel in the middle there is the lymphatic vessel, so that's the end of the lymphatic vessel that would go up to the skin and flush out all the lymphatic fluid that sits around the skin cells. And it's really connected closely to your vascular system. So the red is the arterial system and the blue is the venous system. And so it is really interconnected in these two vascular systems, or if you want to think of it as three separate systems, they really do have to work together to cause all the fluid to go back to your heart and for you to circulate all the fluid in your body so that you don't swell. Other important things about the lymphatic system is it really does parallel the vascular system. So wherever you have veins and arteries, you're going to have lymphatic vessels. So it's a completely extensive network all over and around all of your tissues. The venous system is responsible for getting rid of 90% of the fluid, and the lymphatic system is responsible for getting rid of 10% of the fluid that would sit on the outside and around all of those cells. And the lymph would move in through the vascular system, the lymphatic vascular system, with contractions of muscles that are within the lymphatic vessels, and then contraction of muscles when you're walking and doing exercise, and also with deep breathing exercises that can also help stimulate lymphatic fluid movement. And the system is compromised by surgery when they remove axillary lymph nodes, or lymph nodes even through the deep abdomen. Sentinel lymph node biopsies can also damage the lymphatic system. Radiation as well can damage the lymphatic vessels as well as the lymph nodes that remain. And then obesity can really distort the lymphatic vessels and prevent a good rhythmic contraction of the lymphatic vessels to move fluid. So it's important for people to understand that weight control is essential as well. So what is lymphedema? So lymphedema is the swelling of a body part due to a normal accumulation of lymph fluid that is high in protein. And it can be present in any area of the body, the arm, the leg, in through the face, the abdomen, in through the genitals or the groin. And sometimes it can be in one small little pocket in an area, such that the pocket is small, like maybe the back of the hand, where people don't think that it's lymphedema. They just think that maybe they have a flare-up of arthritis, or maybe they've bumped their hand. But if it doesn't disappear in a fairly quick fashion, then it can be diagnosed as lymphedema based on obviously your history and the type of cancer that you had. It is one of the most important chronic complications after dissection of axillary lymph nodes, and it does have a tendency to progress if it is not managed early on. And we know that the rate of treatment and effectiveness of treatment really does coincide with how early it is diagnosed, detected, and then intervention is done. The incident rate really is from around 23 to 38%. And that typically we see within the first 2 years after surgery has been completed and treatments have been done. And we really diagnose lymphedema based on comparing it to your healthy limb or your good side compared to the side in which has the swelling or the related issue. And we look at a difference of about 10% volume or a 2% measurement in circumference when we measure your lymphedema swelling. And of the people who develop lymphedema, this is really important. 70% of people diagnosed with lymphedema develop it within 12 months of having their surgery and having lymph nodes removed and their treatments done. But the important thing here is that 30% of people can develop it across the course of their life. So the risk of lymphedema after you've had lymph nodes removed or damage to the lymphatic tissues really is across your lifespan. And it isn't uncommon for us to see people who, had surgery 10 years ago and now they have grandchildren and they're starting to lift their grandchildren and they're getting more active in terms of their activity level. And then that's when their lymphedema unfortunately comes on. So really important to know that if the swelling does come on later on, and maybe you're not being followed by, your oncology team, important to maybe ask your family doctor if this could be lymphedema, or reach out and even call the LAO and have a discussion with somebody on the info line. And again, these are the incidence rates that Dolores talked about, but the overall incidence rate is really around 15% for all forms of cancer. And the risk factors are the number of lymph nodes that are removed. So the more number of lymph nodes, we usually say if you've had 10 or more lymph nodes removed, your risk does increase by about 10%. The extent of the radiation that you've had, so the larger the area of radiation, the more likely you are to develop lymphedema. And this is another reason why, radiation techniques are also, continuing to improve. And, as the technologies improve, there's a lot less damage to the healthy tissues. Radiation to the axilla or the inguinal nodes, the nodes in the top of your hip, increases your risk. Post-operative wound infections or seromas, post-surgical drain times. So if the drain times are in for longer than 10 days or 2 weeks, sometimes we will see people being developed with lymphedema when they do come out. If you're not very mobile or you're not very active, you can develop lymphedema as well. And then obesity definitely is a factor. And this is what a typical leg lymphedema would look like for someone who's had unilateral lymphedema. And this could be because of cancer. Sometimes it's in both legs if it's been an ovarian cancer or a gynecological type cancer. It can be in both legs or in one leg, but it typically is, it can start off as a very small difference so that you don't actually notice the swelling, but people will report symptoms, and we'll talk about those symptoms in a minute. And this is what arm lymphedema can look like after breast cancer treatment. And obviously the picture on the other side, on the right-hand side of the screen, is someone who's had a reduction in their lymphatic fluid, getting manual lymph drainage and compression bandaging to reduce their swelling. The signs of onset are important. So I think it's important for all cancer patients to know what the signs or symptoms of lymphedema is, because you will sometimes be you're the person who is living with your arm or your leg. And so you will notice that sensation changes. So there can be a feeling of heaviness, tightness. Sometimes it's a bursting sensation. I often tell people pins and needles, heaviness and aching are not a good sign at all. And so that's when, your antennas should go up and you should be thinking maybe you have lymphedema. Increased size of your limb or a puffiness in the area where you've had treatment definitely is another factor. A feeling of heat or warmth in the limb, shooting pains, the pins and needles and aching. And if your jewelry or your clothing becomes tight, or if your footwear becomes tight, or your socks are starting to leave a large indent into your foot or into your legs. And after abdominal surgeries, you can feel a feeling of tenderness or bloating in the groin or the abdomen. Swelling in the thigh after removal of radiation is sometimes what people will see. And sometimes it doesn't go all the way down into the foot. It can be very localized to the top of the thigh with inguinal node radiation. Or, for people who have axillary radiation, it can be very localized to either the chest wall or the remaining breast tissue, or even just in through the upper arm. And so sometimes people don't notice that as much because they just think that their upper arm is gaining weight. This is a typical thing that I hear in the clinic. And if you get infections or repeated cycles of infections in the limb that is at risk for lymphedema because of the lymph nodes being removed, this is a sign that there's a lymphatic issue, and obviously that lymphedema is developing. And sometimes for people who have had breast cancer, cording are these little guitar strings that you'll feel when you lift your arm over your head or you lift your arm up to the side. Those cords are lymphatic vessels, so part of that lymphatic vascular system, and those cords can usually be an indication that lymphedema is soon to begin if not managed aggressively at the beginning. If you have lymphedema and your lymphedema is worsening, these are typically the signs that people will find. They'll have recurrent infections, their compression garments become too tight, they have pins and needles in their fingers and toes, there's numbness in the area, thickened skin or rough areas, discoloration, leaking of lymphatic fluid through the skin, fibrosis or hardening, color changes to the skin, and decreased mobility in through the joints. And function can sometimes be limited as well. So really important to pay attention to any changes that you notice in your body at all and bring it to the attention of your team. Your team will help guide you, and obviously you can also call the info line for advice or information from us as well. The treatment for lymphedema, the gold standard of care, is called combined decongestant therapy. It includes skin care, compression therapy, manual lymph drainage, and exercise. And I always tell our clients that it has to be a combination of all 4 of these treatments in order for you to know that you have treated and tried to manage your lymphedema to the best of your ability. Lymphedema management is not strictly just putting a compression garment on and going about your day. It needs to include a lot of these different measures in order to make sure that you're getting the best management you can. When it comes to skincare, it's important to follow the general risk reduction guidelines. There are risk reduction guidelines. I talk about them in the book. They're also on the National Lymphedema Network website, and I believe we have them on the LAO website, but really important to not cause injury to your limb, to protect from bug bites, sunburns, any damage to the skin. Damage to the skin can cause infection, and that is what we're trying to avoid. Using a lotion with a pH of 4 to 6 is essential for making sure that you do not have dry, cracked skin. Typically, people with lymphedema have a lot drier skin on the limb with lymphedema than the unaffected side. And it's important, if you're using garments, to use a product or a skincare product that does not have any petroleum in it. Petroleum will break down the elastic of your compression garment. Very, very important. And after you take a shower, you have a bath, you swim, it's essential to dry your skin extremely well, washing and making sure that you dry in between your fingers and in between your toes and underneath creases. So if you have a large leg lymphedema, you have to dry in between all of the creases because we don't want any skin breakdown issues in the area, and we don't want any bacteria or fungus to collect that can cause repeated cycles of infection. Manual lymphatic drainage is also an essential component. It is a gentle skin stretch technique. It is very gentle, if you can see me in the window. To stretch the skin, we start at the neck. For any body part lymphedema, we will always start at the neck. We activate the main lymphatic system, and then we work down our way down your lymphatic system to activate all the healthy lymph node basins. And then we would work on your lymphedema limb to flush the fluid out. With good lymphatic drainage, we can increase the mobility and the contractility of the lymphatic system from 5 to 10 beats per minute to 20 to 30 beats per minute. So you can move that much more fluid, 5 times more fluid in a small, short period of time within an hour treatment session. And the pressure that we put is between the amount of pressure you would comfortably put on your eye. For someone who has tenderness, we would use very light pressure, to about the amount of pressure that you could safely put on a small pet. So it'd be the pressure that you would put on a small cat or a small dog. And that's the pressure that we use to stimulate contraction of the smooth muscles that are in the lymphatic vessels. And this helps move that protein out of the tissue. And treatment is really designed to work an alternative pathway. So it's not, sometimes the things you'll find on YouTube, a lot of people tell me they find videos on YouTube for lymph drainage. You have to make sure that you are doing it properly. If you are doing it incorrectly, you can actually cause more damage and make your lymphedema worse. So I encourage people to see a lymphedema therapist and find out which pathways are open for you and which pathways you need to avoid so as not to cause more trouble. It works alternative pathways. We start at the top of the limb, so we would start at the neck and then the shoulder and work our way down towards your hand and then work our way back up towards the shoulder. And we really are using the surface vessels to carry the fluid away from the congested area. And this is a client of mine that we started with who had leg lymphedema, and with intensive treatment, manual lymphatic drainage, skin care, compression bandaging, and exercise, we were able to reduce his swelling to this, and he had quite skinny legs. And this is compression bandaging, which is the third component to your CDT, or complete decongestant therapy. And it uses the principle of us activating the lymphatic system with manual lymphatic drainage and then applying the compression to help squeeze that lymphatic fluid into the open and active lymphatic vessels to move it away. And then your bandage would stay on until you did your next cycle of lymphatic drainage, whether you're doing self-management strategies or you're seeing a lymphedema therapist. The bandage would come off then, and you would do manual lymphatic drainage again, and then apply those bandages to help force more fluid into that activated lymphatic system. And I should say that when you do manual lymphatic drainage and you activate that lymphatic system to the 20 to 30 beats per minute that it is contracting at, and you move fluid, after you've done a really good hour-long session of manual lymphatic drainage, you increase the rate of fluid movement for 5 to 6 hours. And this is why bandaging is so important, and it's critical for people who have lymphedema to get the best results possible. When we do bandaging, it's called 3-layer bandaging, and it looks like this. This is an arm lymphedema, and that's a leg lymphedema as well. It has 3 layers. It has a protective layer that's like a little thin sleeve. It has a cotton padding layer. Sometimes we use gray foam if there's density, and then we use a compression layer. The compression layer is not a tensor bandage. The compression layer is a specific bandage that is a short stretch bandage that is designed for lymphedema to deliver the amount of pressure that we need. We need a fairly large amount of pressure, around 30 to 40 millimeters of mercury pressure, to get significant reduction of a lymphedema. And we tend to overlap these bandages to get the pressure that we need. So on an arm lymphedema, we would use about 3 of these bandages. On a leg lymphedema, we'd use between 4 and 6 of these bandages. And then the next part of compression therapy would be then when you're in the maintenance phase. So in the bandaging phase, we call that the active phase, or the phase where we're trying to reduce your limb as much as possible. The maintenance phase, we would just use a compression garment, so sleeves or gloves for arm lymphedema. We can get vests for chest wall or breast lymphedema. There are head and neck compression garments that can be over-the-counter products or even custom-made products for very special cases. Stockings for leg lymphedema that are knee highs, thigh highs, pantyhose. I always say the sky's the limit when it comes to garments, because we can do custom options. We can build anything we want into the garments to make sure we're getting the best possible garment. Then there are Velcro options for people who have a hard time putting on these garments, or for people who have paralysis of their limb, or for people who are bedbound. We can also use Velcro options. And then there's nightwear. So a lot of people don't know about nightwear, but when your lymphedema is not being very well controlled with your daytime sleep, we can sometimes get some gains overnight with nightwear, and nightwear does work differently and look differently than the daytime garments. Again, we design your compression based on the location of your swelling, your mobility, your function, your activity, and your lifestyle. All of lymphedema treatment has to include you as a whole person and all the things in a day that you need to do. And so it's essential that your lymphedema treatment is tailored to you. Exercise is the 4th component, and I think one of the very most important components of combined decongestive therapy. Exercise really works on the principle of creating this muscle pump. And if you think of it, it's kind of like a sandwich where your garment's on the outside and your muscles on the inside, and 70% of your lymphatic vessels are squeezed between those layers. When you pump your muscles and contract your muscles against your garment is what you're going to push your skin against. When you push your skin against that compression garment, you will start activating lymphatic contraction of the lymphatic vessel and see a large movement of lymphatic fluid. So exercise is extremely essential. And you know, some people like to walk, and sometimes I challenge them to Nordic pole walk, which incorporates using poles in your hands to activate more muscles in your body. And for breast cancer related lymphedema, it can get a good contraction of the muscles in through your arm to stimulate that contraction while you walk. I call it more bang for your buck when you're out there anyway, because you burn a lot more calories Nordic pole walking than you do walking. Water exercises can be great because you have the pressure of the water. Often a lot of our patients like to be out of their garments in the water. It feels like freedom to them, and swimming can be really great exercise for your lymphatic system. Postural exercises are extremely important. When your posture is very poor, you are going to have issues with lymphatic system function because your muscles are in tone often in through the neck. And when those muscles are really tight, they're clamping down on the lymphatic system and not helping fluid move. So really important if you have other joint body aches or pains to seek out a physiotherapist and gain some control of those issues as well. Muscle imbalances need to be corrected. I think it's essential because it does impact lymphatic fluid movement and lymphatic flow. This is the book that I wrote with my co-author, Jean Lamantia, who is a dietitian. It's called The Complete Lymphedema Management and Nutrition Guide. It is really designed as a guide for you to learn some strategies about lymphedema management after you've seen a lymphedema therapist. So it talks about everything I've talked about in even greater detail and has all the research in it. And if you go to my website, I have a coupon code. It's LAO 2020 because of the all the presentations that we've done at the LAO. And so I am offering the book at a reduced price. You can also get it on Amazon, Chapters, Indigo, all major bookstores, and it is almost sold out. They're into their second printing, and we're super happy and excited that it's been able to help people. Thank you.
Great, thank you so much for your presentation. So we still have some time left for questions. We have a few that have been submitted already, but if you still have any questions that you would like our presenters to answer, you can still type them into the question box. So beginning with some of the ones that we have right now, are cold limbs, feet, and hands related to lymphedema?
Cold, not necessarily. And I would encourage, like, if you have swelling and you have cold hands and feet, it could be a circulatory issue. I would definitely reach out to your team and discuss that with them. Typically, we don't see that with lymphedema because the blood circulation is not affected by lymphedema. So you should be getting adequate blood flow to your limbs, even when you do have lymphatic swelling.
Next question, is running okay for lymphedema patients, or is that too much strain?
I would say that your prior level of exercise will indicate what you can safely do after. So if you were a marathon runner before, then you're likely going to be returning back to running. If you were someone who was sedentary before, you haven't had a large, extensive experience with exercise, running is probably not the thing for you. It may flare up like lymphedema. But again, like, you have that pounding force, and it can definitely flare up lymphedema if running is not something that you're used to doing. So usually I encourage people to return back to exercises they were doing before, and then to do that in a very slow and progressive way so as not to flare up your limb. Or if you're just at risk for lymphedema, you want to integrate exercise extremely slowly and monitor for symptoms, that heaviness, aching, pins and needles. If you have that, then the exercise you're doing is too much for your limb. And then I would gear it back and then have that discussion with either a physiotherapist certified in lymphedema or your lymphedema therapist, your medical team.
Next question, can muscle stimulators be useful in treating lymphedema?
We haven't done that, and I've not seen any research on muscle stimulation helping manage lymphedema. So I'm going to say I don't think so. And in the past, we've actually seen some people flare up because of muscle stimulators. So be very cautious.
Next question, how long does it take to shrink the swelling using the bandage therapy?
That will depend on how swollen your limb is, and how long the swelling has been there. If the swelling has been there for a very, very short period of time, and it's very soft, sometimes we can get rid of it within 2 or 3 sessions, so within a week. But that means a week that you have to stay in the bandage. If the swelling has been there for a long period of time and it is a lot of swelling, it can take 6 or 8 weeks. And again, a lot of self-management that we would encourage you to do, and your lymphedema therapist should be encouraging you to do along the way when you're in the intensive phase for that 6 weeks.
Next question, would you be able to speak a little bit more about advocacy efforts that the Lymphedema Association of Ontario has been involved in, and have there been any successes?
Dolores?
Yes, hi. Yes, currently what we had done is engage.
Oh, we lost her.
I think your audio cut out for a second, Dolores.
Oh, sorry. Can you hear me now?
Yes.
Yeah.
So one of the things that we had been doing is we'd been having discussions with MPP that is a member of the LAO as to what information is required to put forward to the government, to the Ministry of Health, in order to help to get treatment for patients. And we were told that we needed to collect a number of stats to make a business case and to impress upon the government that if we had treatment, maybe we won't end up in the hospital or with cellulitis and infection. So we needed to gather data that we currently don't have. It's why we've been tabulating the infoline queries to get information and asking our members for patient stories and possibly pictures so that we can put a story together. So we need to do more. We've currently written to the MP with all of the information we had to try to get us a meeting with the Ministry of Health in order to present our case. So in the meantime, what we're trying to do is pull all the data we can together to complete the business case. Because without hard facts, without hard numbers, without being able to show some kind of savings to the government, that if you treat us and we're all in control of our lymphedema, maybe we won't end up as a burden to the Ministry of Health in hospital or for other treatment. So that's where we're at right now. Prior to 2018, we had done a number of surveys for patients and therapists. We've gotten some information back, but that information alone wasn't sufficient to make a good business case. So that's where we need your help.
Thanks, Dolores. Next question is, do you recommend any vitamins or supplements that could help cleanse or move lymph fluid?
Well, I'm a physiotherapist, so that's not my area of expertise, that's for sure. But to my knowledge, there isn't any particular vitamin or supplement that's been really researched rigorously to show benefit for moving lymphatic fluid. So, you know, be super cautious when you are taking supplements.
Next question, do you know if there are long wait lists to see lymphedema specialists?
Is that pertaining to doctors? So, okay, I'll explain. So lymphedema therapists, we all function in private practice, and so there probably isn't long waiting lists. Most clinical practices try to see people within a short period of time, because we know that if we make people wait for 2 or 3 weeks, their lymphedema can progress that much faster. And then it's also a lot harder to treat, and then we have to have them in clinic longer. So typically in our office, we would see somebody the same week that they call. That's why our hours are very sporadic, but we do extend our days to make sure we fit people in. it's good to find a therapist out there that has availability to see you if you have a problem, and not to wait on a waiting list for weeks at a time, because it can progress. If you're talking about doctors who are specialists to diagnose it, to my knowledge, that would be your oncologist that would be doing the diagnosing, or your lymphedema therapist, because I'm a physio and we can also do that as well. And then we work with your doctor, your medical team. Vascular surgeons, for people who have swelling that they haven't determined exactly what it is, and they're worried if there's a vascular issue because of coldness in the limb or discoloration or color changes. Vascular surgeons would be the ones that would help diagnose what is going on. And then if nothing else is going on with the vascular system, then they would diagnose lymphedema as a diagnosis of exclusion. But I know that most of the people on this presentation are cancer survivors. And so typically the diagnosis of lymphedema is quite easy when it comes to cancer patients, because typically you've had treatment, surgery, radiation, and they've removed lymph nodes. So it's quite common to see lymphedema in those limbs that have been affected by having the treatments.
Right. And if you allow me to jump in here, there were two things I wanted to say. The LAO is currently trying to put together a list of the doctors who can actually diagnose lymphedema. That information is hard to come by, but we have been working on it and are hoping to put that together. We already have a hospital list, and we have posted that online and on our website that identifies which hospitals and which doctors are there and which have lymphedema clinics. The second point I wanted to raise, which I forgot earlier in the answer to what are we doing for advocacy. So for March, for Lymphedema Day, we also launched a letter writing campaign to individual MPPs, and we have posted these templates on our website, and we have been asking all of our members to please write to their individual MPPs, identifying that we need help and we need treatment. This campaign was also done in BC and was successful. They are in the midst of it, and there are some other provinces doing it as well. So we're asking again that if you can do this for us, please do that, because the more MPPs we touch and raise awareness, the better it is for all of us in the end.
Next question. Once bandaged successfully, can the lymphedema come back?
Yes, so the lymphedema can come back. That depends on a lot of factors. When you're bandaged for a long period of time, you need to be slowly weaned from the bandage and moved into your compression garment. If the lymphedema comes back, we need to adjust your compression garment so that you get more stability from your compression garment. So sometimes that's about making sure that you're in a better fabric. There are a lot of fabrics out there that people don't know about. So we can get people into different fabrics or higher compression garments, like a 30 to 40 instead of a 20 to 30 millimeters of mercury pressure. If the swelling returns, then sometimes we call it rebound swelling, and that can be a sign that people have a very stubborn lymphedema. But really, after you bandage and do effective bandaging, your swelling shouldn't return to the degree that it was prior to bandaging if you have been put into a proper compression garment.
Next question. What are your thoughts on dry brushing?
Dry brushing can be helpful. I usually tell people that learning to do self-manual lymphatic drainage using your hands is still better, because you'll know how much pressure to apply, and you'll make sure that the contact between your skin on your hand and the contact between the skin on your lymphedema limb is going to maximally stretch the skin so as to contract the lymphatic vessels. But dry brushing can be used for difficult areas, I usually tell people. And you have to be careful with the brush that you're using, making sure you're using something that is not too abrasive. We don't want to have any microtrauma to the area that could create infection. And we definitely don't want any redness to the area, because redness to the area after dry brushing can also increase fluid flow to the area and blood flow. So you end up with more swelling after. I know that somebody has, what is your website? So you can find me at www.markhamlymphaticcenter.com.
Just scanning through some more of the questions.
There are quite a few here.
Yeah, there's so many to sift through.
Someone who is talking about prostate cancer. So, I mean, prostate cancer that has moved into the lymph nodes in through the abdomen can cause swelling in a number of different areas. It can cause swelling in through the lower abdomen, usually up to the belly button area, because that's a lymphatic watershed. So just in terms of how your body's been divided in terms of its lymphatic system, in through the lower abdomen, in through the genitals, in through the legs, and in through the buttocks areas, typically where you will see swelling for men who've had prostate cancer. But it can be managed and treated quite effectively. Aggressive management is really important. And there is compression that can be done for scrotal swelling or genital swelling.
I see another question here. How do you differentiate between lymphedema and lipedema?
So lipedema is a disorder of irregular fat metabolism and deposit. So it tends to be very loose and it looks kind of like that cellulite. And so its texture is very, very different. It's often very grainy. It can feel grainy like grains of sand or grains of rice under the skin. There is a distortion of the lymphatic vessel system with lipedema. And so lipedema does lead to lymphedema. And we know that the same treatments cannot be applied to both conditions. Lymphedema, again, it's a diagnosis of exclusion. Lymphedema, the tissue feels different. There's often pitting edema at the beginning, not always. There is a reduced skin stretch. It's more pillowy, soft for lipedema, and it's more dense or thicker skin for lymphedema. And we, based on whether or not we can pick up the skin, that's typically a lipedema. Lipedema, we can typically pick up the skin. Lymphedema, we typically can't pick up the skin in an area because it's so full of fluid. So that's how we differentiate based on the presentation. And obviously medical history helps us differentiate as well. If you have a medical history that is leading us down the road of thinking you have lymphedema because you've had lymph nodes removed in an area, you've had cancer, and you've had radiation, then we will often diagnose it with lymphedema. It isn't uncommon for people to have lymphedema and lipedema. And so that's another important thing. Like there are some people that have both. And we do have people in our office in that situation.
Thank you. So it is just 2 o'clock now. So unfortunately, we do have to wrap up. But if you still have additional questions about lymphedema that we weren't able to answer today, they are available to answer your question.
Easily send me something through the Markham Lymphatic Center website. There's an inquiries page there. I'm happy to answer any of your questions. I mean, this is why I'm part of the LAO, is to share our knowledge and try and help direct people in the right direction. This is a condition that not a lot of people understand, and it is very hard to find a lymphedema therapist. You need somebody who will work with you one-on-one and show you self-management strategies. You have to learn how to manage lymphedema well, and you need to learn how to do self-management strategies because that needs to be done every day, and you can't stay in a lymphedema therapist's office every day. At least you can't stay in ours because ours is extremely busy already. We teach a lot of self-management strategies. It is essential to managing and living well with lymphedema. You just need to find the right tools. Please use the book. The book is an amazing resource to at least help you get started if you're new to the journey of lymphedema, or even if you haven't had lymphedema. It's really important to try and prevent it. So that was really why the book was designed and why we wrote the book to begin with. Thank you all for attending.